This Week with Bob Mueller on News 2.
This week,
it is not the Omicron variant to our knowledge.
COVID cases begin a slow rise once again in Tennessee, but so far, no confirmed cases of the Omicron variant. You will hear from State Health Commissioner Dr. Lisa Piercy.
That the city is taking the challenge of the bombing and creating opportunity.
Plans are in the works to restore the Christmas Day bombing damage to historic 2nd Avenue.
Why not talk about it so that we can do better going forward?
After years of controversy, a statue of Confederate General and KKK founder Nathan Bedford Forrest comes down from its I-65 perch.
You know, I think it's important to know that there are like 1.6 million people with disabilities in Tennessee.
The recently signed Tennessee omnibus COVID law, which bans mask or vaccine mandates, may violate federal law. You will hear from the executive director of the Tennessee Disability Coalition.
It's a red state, and red states have tended not to be as aggressive in terms of vaccination.
Former GOP Senate Majority Leader and heart surgeon Dr. Bill Frist says leadership matters when it comes to fighting COVID-19. More in our This Week cover story. Hello again and welcome to another edition of This Week. As you saw, a Tennessee heart surgeon who also happened to be the Senate GOP Majority Leader has advice for Tennessee leaders as they deal with the COVID-19 pandemic. More in our This Week cover story. But first, a look at the other political headlines of the week. It sat above I-65 for more than 2 decades, a statue of controversial Confederate general and KKK founder Nathan Bedford Forrest on horseback, surrounded by flags for each state of the Confederacy. This week, the statue came down, sparking mixed reactions from those who called it hideous, racist, a symbol of hate, to those who say it represents history. News 2's Alex Dennis spoke with supporters on both sides.
The statue of Confederate General Nathan Bedford Forrest partially crumbled while being dismantled along I-65, a visual metaphor representing the fragile state some believe our country is in.
We have so much more work to do.
Anthony Hendricks is the co-founder and director of The Public, a group out of Franklin that promotes anti-racism through education. He says removal of these statues often pits two sides against each other, those on the, quote, right side of history and those who don't want the past erased.
You cannot remove history. History is there, right? We live in history right now. Why not talk about it so that we can do better going forward?
It's a conversation Lee Miller with the Sons of Confederate Veterans has been hoping to have for years, as he sees monuments dedicated to Confederate soldiers removed, like Nathan Bedford Forrest, who many refer to as an early leader of the KKK.
Historical markers need to be put up, more of them.
For context, he says, referencing a report by the Joint Select Committee of 1872 that credits General Forrest and other men of influence for disbanding the Ku Klux Klan and similar groups.
There should be markers and monuments to the black soldiers on both sides, including black Confederates, but it should be the truth. It should be correct.
As with any story, there's multiple chapters and characters develop, which is why cherry-picking facts hurts more than helps.
The taking down of a statue does not help with the educational disparities that still exist in America.
Hendricks feels if people don't take the time to read the not-so-pretty parts of history for themselves, then the cycle of misinformation perpetuates.
Education is power to me. And so the more information you can have, I think the better equipped you are to deal with life, to handle different situations that come your way, to respond properly to these issues that we're dealing with still in our nation.
News from our state capitol newsroom. The battle over COVID misinformation is heating up. The Tennessee Board of Medical Examiners is reviewing a September notice to physicians. It notifies them that COVID-19 misinformation could lead to disciplinary action. News 2's Gerald Harris has more.
The state medical board says physicians have an ethical and professional responsibility to practice medicine in the best interests of their patients and must share information that is factual, scientifically grounded, and consensus-driven for the betterment of public health.
I think it's very important that as physicians we're held to a high standard because what we do matters, especially during a pandemic.
While some doctors agree with the stand against medical misinformation, leading Tennessee politicians do not. During October's special session on COVID, GOP lawmakers led a ban against disciplining doctors who prescribe, recommend, or use treatments not approved for COVID-19.
When you insert politics into science and medicine, you are slowing down progress, and bureaucracy is a big machine that moves at a very slow pace.
Special rules regarding COVID policies from the medical board must now be approved by the General Assembly.
They need to give us the right information and what these medicines consist of, because people are dying over COVID, and if they give us misinformation, then who knows what can happen.
Doctors say this comes down to trust.
We need to be able to ensure that our profession is trusted and that the information that we're providing the public is accurate.
Physicians are also asking the board to take their oath and the oath of doctors across the state to do no harm seriously.
There are going to be outliers out there. There will be physicians who will say things that go against the grain. What I would tell people is when you have the vast majority of doctors and scientists and public health officials telling you that vaccines are safe and effective and that ivermectin does not work to treat a virus, listen to the majority.
Nearly a year since the Christmas Day bombing ravaged historic 2nd Avenue, and now Mayor Cooper is sharing plans for the future of 2nd Avenue as much of the area remains fenced off. News 2's Stephanie Langston walks us through what lies ahead.
Well, it's very hard having disruptive change with the bombing.
2nd Avenue will never be the same. The old spaghetti factory and B.B. King's among those businesses that won't return to the historic stretch.
I do think that the city is taking the challenge of the bombing and creating opportunity.
As we turn the page to the next chapter, city leaders are looking to reinvigorate the heart of downtown.
2nd Avenue will have more urban activated, livable streetscape.
That's part of Phase 1 of downtown's long-term rebuild, with the Metro Council approving the mayor's latest capital spending plan of $20 million to fund the early work.
We're going to have more activation for more businesses in the future along 2nd Avenue.
Plans include transforming the most devastated buildings into a boutique hotel with a passage to 1st Avenue. The Dreams paint 1st Avenue as the city's front porch on the river.
Those buildings were built in the late 1800s, and we're preserving as much of those as we can. The reality is the faces were blown off, so we're going to do as much as we can to preserve the pieces that we can find, but we can't recreate history. We have to interpret it in a new way.
Just across the way, the 9-story AT&T facade sits burned and charred, but it will soon pay homage to local artist Phil Ponder's Market Street 2, embracing the future while honoring the area's storied past. A priority for city leaders, business owners, and residents, as we still heal with plans to recover only stronger than before.
You just have to build new memories and make new stories.
Now to our This Week cover story. As Tennessee wrestles with COVID-19 and concerns about a new variant, more people are catching the virus ahead of the holidays. News 2's Gerald Harris speaks with former Republican Senate Majority Leader and Nashville heart surgeon Dr. Bill Frist, who says leadership matters when it comes to fighting this virus.
Probably a B.
Dr. Bill Frist gives Tennessee a passing grade so far in the state's COVID response.
It's a rural state. Lots of different opinions. It's a red state, and red states have tended not to be as aggressive in terms of vaccination.
But Frist, a former Republican senator and majority leader, says more can be done, from reducing health disparities.
If you happen to be a person of color or a person in a vulnerable population, your chance of dying from, for example, a virus or a pandemic is much higher.
To shoring up investments in public health.
That's science. These viruses are smarter than us, and they're changing constantly, and they're going to come again.
Frist, who was part of the Nashville COVID-19 response review to examine the impact of COVID-19 and issue recommendation, says leadership will be key in the success of fighting back against COVID.
Where we had a president of the United States saying one thing, typically or often inconsistent with science. We had the science side by side saying something quite different. And yes, it changed over time because science changes over time. But that message was very different what the state level, what our state legislature was saying and what the governor was saying. And then that's very different than what local communities were saying.
With just 50% of Tennesseans vaccinated, near the bottom of all states, Frist says consistent communication of trusted leaders should be a priority.
And that inconsistency of communications, especially in times of crisis, leads to hesitancy, to distrust, to locking down, to say, no, I don't want a vaccine, or no, I'm not going to listen, or to go and listen a little bit more to these misinformation sources. So that needs to be addressed.
In Nashville, I'm Gerald Harris, News 2.
Over 17,600 Tennesseans have died so far of COVID-19 complications. Stay with us. This week continues in a moment. Welcome back to This Week. I'm pleased to be joined by Carol Westlake. She is the Executive Director of the Tennessee Disability Coalition. Welcome and thank you for your time.
Thank you. Thank you.
As you're well aware, the Tennessee General Assembly in special session did approve the COVID-19 omnibus bill, most of which has now been signed into law. Bottom line, it effectively bans school boards, schools, hospitals, health departments from implementing mask and vaccine mandates. Regardless of circumstances, it bans that outcome. You have called this literally a life and death situation for many people, not the least of which includes Tennesseans with disabilities. Explain how.
Absolutely. You know, I think it's important to know that there are like 1.6 million people with disabilities in Tennessee. So we're not talking about a small number of folks. In schools, it's probably about, between 14 to 15% of kids have a disability of some variety. If you add kids who have health issues, it's probably even more than that. And for those kids, it can be a life or death issue to catch a disease or a virus like COVID. And in doing safe protocols, wearing masks, those kinds of things that keep people safe are so critical for folks who are the most susceptible.
You call it a flagrant disregard for the American with Disabilities Act, a law which does protect the lives of, as you said, 1.6 million Tennesseans, and as you said again, calling it a gut punch. All that is good, but what can you do? I've assumed federal lawsuit is going to be challenged with the legislature, a supermajority Republican governor. They're not going to change their minds. You're probably not going to win there. What aspects do you have?
Well, I mean, there are a couple of things. I mean, one is the governor has said that he thinks there need to be some tweaks to the bill. We're hoping that we're one of them, with any luck.
On the other hand, they said they could tweak it harder, too. So
there's that. I hope spring's eternal. Because I think that if people really understand the impact on students, on children, that they will think about it a different way. So there's that. I will also tell you that there are 3 federal lawsuits already in place based on the Americans with Disabilities Act for families who are scared to send their kids to school.
Yeah, you're following my line of questioning because you say these families impacted by this legislation are literally terrified to send their disabled or otherwise medically fragile children to public schools and to even speak out against the legislation. Do they feel threatened?
Absolutely, absolutely. I mean, when you look at the fact that we had a public health official who lost her position and felt the need to move out of state, whose husband was threatened at a school board meeting, it's really hard to look your neighbors in the eye and speak your truth, right? Or to call the principal and say, this is something that really needs to happen to protect my child.
You talked about the federal lawsuits. They will work their way through the courts, but that takes time.
It does
in the
take
meantime, this law is in effect. So what can be done so these children are accommodated so they can feel safe going to school if the ban on any kind of mask mandate is regardless of circumstances, is not going to happen?
I mean, I think there are a number of things, and one of the things that we have been trying to do is to help families think about the ways to have reasoned and reasonable conversations with school officials, for example, and really talking about the fact that the single accommodation of we'll put your kid in a separate place with separate people who are masked is not sufficient. Really hard if you're an 8-year-old, right? And somebody says, well, you don't get to go to lunch because You know, your mom says you have to wear a mask, so you got
that stigmatizes
that's
the
very,
child.
very stigmatizing. So what we're trying to do is help families and parents think about good ways, do some advocacy training, right, about how to have those conversations with school officials, how to have those conversations with your neighbors.
Do you see this as a state government overreach where they're banning health officials, school officials from a tool to protect the lives of their people?
I think it is a state government overreach. And I'll tell you, it worries me a little bit because, you know, it's not just about schools. It really is also about businesses. Most of my employees have disabilities themselves or have family members with disabilities. And to say I can't require my staff to follow safety protocols, to be vaccinated, to wear a mask when they're in the office is something that's really, really scary. And from a business perspective, that's really difficult. I mean, we heard what Ford reached out to the governor when this was happening. Do you know, when you've got people like Ford, you've got Amazon, you've got Oracle, who really have been promoting disability. They include people with disabilities in their ads. They've got diversity programs going in their businesses. And then they come to this state, and this is a state that appears to not necessarily share their values. I think that we are a pretty disenfranchised group, absolutely. But we're also 1.6 million strong. And I think that, you know, one of the things that we do as a coalition is really try to help with advocacy, to help with self-advocacy, to help people really push. There's a business case to be made for doing the right thing for people with disabilities as well.
Carol Westlake, the Executive Director of the Tennessee Disability Coalition, thank you very much for your time and your insight.
Thank you.
Stay with us. This Week continues in a moment. Welcome back to This Week. At her briefing on Monday, State Health Commissioner Dr. Lisa Piercy said the Omicron variant is not yet in Tennessee, but it will be sooner or later. Here's more of what the commissioner had to say about the status of COVID-19 in our state.
We have had a very slight increase in both cases and hospitalizations over the last 2 or 3 weeks. This is not a spike necessarily. It could be just kind of leveling out where we are. But when you're at this stage, you don't really know. And so we're not alarmed about it, but we have seen a little bit of an uptick over the last couple of weeks. Interestingly, a lot of the cases and most of the new hospitalizations are clustered in Northeast Tennessee, and they are still amongst the largely unvaccinated population. I can tell you what it's not, to our knowledge. It is not the Omicron variant, to our knowledge. There are a lot of things that we know about that, but there are even more things that we don't know. What we do know is that the Omicron variant has been identified. I've lost count of the states. It's plus or minus 15 states now. So it's just a matter of time before Omicron is here in Tennessee. There is some speculation that it is more transmissible. Maybe, we'll see. There is also some speculation that it could be less virulent, which means it makes you not as sick. It's not any worse. It may even be a little milder. Those are things we don't know yet, but those are things that we're going to be learning over the next several weeks as the Omicron variant takes a bigger hold in the United States, and it will inevitably come to Tennessee. What we do know is that vaccination is still the best protection. There's a lot of questions out there. Does the vaccine protect against the Omicron variant? We don't know that yet. But what we do know is that vaccination is the absolute best way to protect yourself, not only from infection, but specifically hospitalization and death from any variant. And in the 5 to 11-year-old category, I think we're hovering around 7 or 8%. That seems really low, and it is low, but then I looked at all the southern states. It's kind of in the middle, maybe on the high side of the middle. There are some of our border states that are at 3 and 4% of those young children. Then when I was looking at the 12 to 15-year-olds, don't quote me on this number, but I want to say it's in the 35 to 38% range. That's actually pretty good. And again, about middle of the pack of where we are in the South. So, I'm encouraged that we're holding our own. I do encourage parents that if they want their child vaccinated, it is a safe and effective vaccine, and there are lots of places to get it.
Stay with us. This Week continues in a moment. I want to thank you for spending part of your weekend with us. Everyone's busy during this upcoming holiday season. That will do it for another edition of This Week. We hope to see you back here next weekend for another edition of This Week, and you have a great week.